George Sanders. Upper eyelid surgery is a very popular procedure in our office. Many people do it for reasons ranging from they want to look better, they want to be able to see better, so that when they look up, they're not seeing a curtain of skin, or they're changing lanes in traffic, they're not blocked by their upper eyelid skin. The operation is done under a light sedation anesthetic, or it can even be done under local anesthesia. It takes about a half hour to an hour to do. We're taking away excess skin and fat from each upper lid. That leaves a little tiny incision line which is hidden by the natural skin crease. Recovery is about a week long before you're getting back to normal activities. By 2 weeks, most of your bruising is gone and you're looking really ready to go. It's a very popular operation because you gain so much for relatively little investment in terms of time and discomfort. So if you're thinking of doing an upper eyelid lift, feel free to give us a call. We'd be delighted to provide you with information.